Hello, everybody. It's Laura Ellen Christian with AGE-u-cate Training Institute. Welcome to our webinar for today. As usual, we're going to give a minute or two and let everybody roll in. I know with life, we're waiting until that clock turns to the next hour and our calendar invites ding, and then it takes us a few minutes to click on that link. So we'll let everybody roll in, but we're excited to have two guests for us today, and we're going to be digging into the topic of brain health. So in a few minutes, I will introduce our guests and our topic, and we'll get started. But we hope everyone's having a good Wednesday in September. I'm in Georgia, and we're starting to get hints here and there of fall coming. I don't know about Alex, Dr. Fenn, or Van. What's the weather like as we stall here for a few minutes to let everybody roll in?
Well, I'm in Jackson Hole, Wyoming, where fall comes in early August.
Yes.
Like it's where it gets cold at
Yeah,
night.
you're already in
Now
sweaters.
we're like almost full on fall. So it's
Yeah,
really lovely.
that
Yeah.
is lovely. I'm jealous.
We it is starting to turn here in the Northeast too. I'm starting to see some yellow leaves and yeah,
Mhm.
crispy mornings, but still kind of gets hot in the afternoon. So
Yeah, yeah,
Yeah. I'm in Texas, so we had fall last week, and then we're back to summer. And
yeah,
but the mornings are just a little bit crisper, so that's nice.
Oh, that's
mhm.
nice.
Yeah.
Where in
yeah.
Texas are you, Van?
Dallas Fort Worth area,
Oh, you're in Dallas. Okay.
closer
I
to
just
Fort
had a
Worth.
friend visiting me from Dallas this weekend, and I
Oh,
took her
okay.
camping, and I don't think she's ever been so cold.
I was going to say, I bet she froze. Right. We're
Funny.
just not used to it.
Yeah.
Yeah, well, if you're on, we'll get started. Some people are chatting in about how the weather is where you are. So please do that as we enter into our topic today. But we're going to go ahead and get started. So again, I'm Laura Ellen Christian with AGE-u-cate Training Institute. We are so happy to be connected with you again. I think this is our third or fourth webinar of the year. And we've got one more coming up in November to close out the year. So it's been full of really great, engaging topics. And this one I know will not disappoint. So we're going to dig into brain health. I think it's a topic that everybody is thinking about. And we definitely wanted to align it at AGE-u-cate with our recognition of World Alzheimer's Month. So, AGE-u-cate usually leans into September as World Alzheimer's Month, where we do a lot of pushing out of information and highlighting everything that's happening throughout the industry. And I know that brain health is such an important topic. For World Health or World Alzheimer's Month, they really focus on prevention and they focus on what action we can take, right? So we can talk all day long, we can learn things all day long, but if we don't take action on what we learn about or things we talk about, it really falls flat. And so I think that's where our conversation will be today. So we really hope that you not only learn something new or think about conversation that you can spark from this, but you also leave with at least one action that you can take personally or an action that you can help your organization take as we all work together around the same goal of health for all of us. That includes all of us here. It includes the people that we support, whether that's in our personal life or our professional life. So again, welcome. I'm going to ask Van, who is on the AGE-u-cate team, to do a little introduction to around the full circle moment of what has brought us here to this topic. So, Van is a little bit of a fangirl of one of our guests, Dr. Fenn. And then we have Alex as well from Hilarity for Charity, which we equally respect and are glad that are here. But, Van, why don't you share a little bit about kind of the full circle of what brought us here in this topic.
Great, would love to. So, personally, I celebrated my 60th birthday this year, and thinking more and more about action items and things, how important I felt it was to maintain brain health. And so I just really started going down that path and looking at that. And I discovered the Brain Health Kitchen book by Dr. Annie Fenn and decided to just order myself a copy and got it and was there it is. And here's mine, which is already is
Oh,
bookmarked and it has
oh,
tabs all.
I love seeing it being well loved.
It is absolutely well loved. So I got it and started reading it and truly, truly couldn't put it down. And I'm a big reader. And what I was so captivated by it was that how much information was in and how practical that information was. And so I started reading all the chapters, and it really is. I keep telling everybody it's a book full of information that also happens to have some fabulous recipes in it. So I was so impressed with it. Tried a few things, loved the recipes, and thought, you know what? I just want to gift this. That other people need this, and I decided to surprise the AGE-u-cate staff and had a copy sent to everybody on staff and just said, "Hey, this is it's easily digestible. It's easy to get. You can start small, you can start big. So have this." So we've been rocking along. I make quite a bit of things out of this. I've adjusted some habits of my own based on information I've read here. I have started following Dr. Fenn. I'm on her Substack now. I'm trying not to just completely stalk her, but and then I will be really honest. This webinar was being planned, and I'm not normally in on the webinar planning side of things. And I saw the graphic for this, and I got so excited. I'm like, oh, Dr. Fenn's going to be on here. I'm so wait, wait, wait. We
You're
have Dr.
totally
Amy
making
Fenn
me
now.
embarrassed.
Yeah. So anyway, so there we are. I've made the recipes for the staff when we've come together. I was actually sitting here with my one bowl cookies that I made this weekend.
Those are good.
So anyway, I know you're going to love hearing from both of these ladies, and I'm excited to be here as anybody. So
Yeah. Thank
Well, it's
you.
an honor and a privilege. Thank you so much.
Yes.
uh,
Yeah. So that
pumpkin
was
muffins.
really excited for our team because we kicked off the year with a relationship with Hilarity for Charity and really digging into the Taking Care documentary and using that to really celebrate 10 years of impact with Educate's Dementia Live program. And so over that time and this year, we've developed our relationship deeper with Hilarity for Charity and started brainstorming around another webinar. We had Bonnie on to really help us dig deep in the Taking Care documentary, and then this opportunity popped up, and we were like, wait a minute! I think that's the same thing that we've already been doing. So I love when the universe brings those things to you. It kind of gives you a little. A little pat on the back, like maybe validation, you're living right, you're doing the right things when things come together like that. So yes. So without further ado, I want Alex and Dr. Fenn to introduce yourselves and share a little bit about the collaboration between Hilarity for Charity and the Brain Health Kitchen. And then we're going to jump right in.
Great. I'll
Okay.
start and then I can hand it off to you, Annie, since I think you're going to go right into the slides.
You bet.
But yeah, HFC and Brain Health Kitchen we're fast friends, and we've been working together since really right before COVID, when we came together to start looking at how we can bring brain health to dementia family caregivers. So, Hilarity for Charity is a national nonprofit organization. We've been a nonprofit for about 9 years now, but we've been operating for 12 years. We were founded in 2012 by Seth Rogen and his wife, Lauren Miller Rogen. When Lauren's mom was diagnosed with early onset Alzheimer's, and Lauren at the time was only 25, and she and Seth had just started to date. And really, HFC was born out of a desire to, you know, find community, create community, kind of bring the discussion of Alzheimer's out of the shadows. And so that's why our tagline is bringing light to Alzheimer's. And really, Seth and Lauren kind of leaned into what they knew, which was comedy and entertainment. And so we really started as an event. Hilarity for Charity was a variety show that Seth and Lauren put together to raise money. And over time, the event sort of grew and then programs started to develop. And so when I joined 6 years ago, we were sort of just getting started on delivering programs for dementia family caregivers. And we started to team up with Brain Health Kitchen, thinking about, how can we also bring this information to caregivers for their own well-being? And then COVID hit. And so we quickly pivoted to putting together these sort of Friday webinars, like just lunchtime webinars for caregivers, and put together a couple sessions with Dr. Fenn around easy recipes, for caregivers themselves and in the course of their caregiving. And our partnership has really grown since then. And so we'll talk a little bit more about that. But it's been an honor to watch Brain Health Kitchen grow. And we at HFC are also big Fenn fans and really happy to have Dr. Fenn as part of our science advisory board.
Well, thanks, you guys. You're really making my whole month. You're so sweet. So sweet. So just like HFC started about 10 years ago, I launched Brain Health Kitchen in 2015, in my home kitchen with a group of people who were interested in longevity and learning how to age with a healthy brain. And it was really sort of a grassroots thing. But I'm a medical doctor. I'm an OB/GYN and I practiced that for a very long time, 20 something years. And when I retired from my medical practice, I decided I wanted to do something in food and community and health because I really felt like the root cause of even a lot of the conditions that I was treating as an OB/GYN were rooted in lifestyle and nutrition. So I was really fascinated by how certain populations age really well and without dementia. And so I went to culinary school and I came back and I started teaching healthy cooking in my community. Literally like at the Elks Lodge for $12 a class, like starting over, right? With a new career. So I was doing that work when my mom was diagnosed with mild cognitive impairment, MCI, which turned out to be an early stage of Alzheimer's. So, as most doctors would do, or most family members would do, that sent me onto a deep dive in everything to learn, about, how do you slow the process down? Can nutrition be a viable factor? Can you actually prevent these neurodegenerative diseases, especially Alzheimer's, with nutrition and lifestyle? And even back then, 2014, 2015, I found a mountain of data to support lifestyle interventions to prevent Alzheimer's. Now, back then, people didn't use the word prevent and Alzheimer's in the same sentence. And I know you remember this too, Alex, and probably all of you at AGE-u-cate. But there's a lot more education, and the data just keeps growing. So Brain Health Kitchen was started as a cooking school. I wanted people to learn how to take care of their brains, but to do it in like a kind of a fun environment. Like there's no better place to learn and have fun, I think, than in the kitchen with other people. It's very team building. So I wanted to use the kitchen as sort of our lab, our classroom. So that's the basis of all my teachings. So as you guys know, as Van said, it's now Brain Health Kitchen is now a book. It's a newsletter. My newsletter goes out to over 30,000 people in 150 countries, which kind of blows me away. So there's a lot of interest in how to take care of your brain as you get older. We talk about not just Alzheimer's, but other types of dementias now that we know that other neurodegenerative diseases can also be prevented or delayed with nutrition and lifestyle. So that's what I've got going on right now. So I do a lot of education. When I was first dreaming of writing a cookbook that would help people, what Van did by giving all of her teammates this book was exactly what I was hoping, is that the book would get into the hands of people who are, in the field of brain health, who are sort of like the change makers and the thought leaders, and then have it trickle down into like every single caregiver because caregivers need to take extra special care of their brains, as HFC does so well in communicating, and even younger people. So a lot of the recipes in there are designed for people of all ages, all cooking abilities. Um, Everyone who just likes to eat is included, basically.
Yes, well, thank you both for sharing a little bit about how each of your organizations got started. And I think that's exactly what we want this conversation to be, right? Like, so Alex and Dr. Fenn, you both shared how something, an event, right, sparked action, and then that action grew into something bigger and bigger and bigger, and how those ripples continue to have positive effects and impact in the world. So that's where we want to kick off. And I know, Dr. Finn, you wanted to start with sharing a little bit, or we want to start with sharing a little bit about brain health as a whole and how it can connect to you as an individual. Because it's hard to want to spark change for organization if you don't have that spark for yourself individually, right? So we'll start with that, and then we'll pop over to Alex and how this has been really translating not only within our industry, right? So a lot of people within AGE-u-cate's network are in the aging services industry, in the work, the important work of supporting people living with Alzheimer's and other types of dementia and supporting care partners, whether that be family or professional care partners. And then we'll say, well, we know that you're in that space and we want this to ignite something for you personally, but also for your organization, the industry. But then we'll pop over and talk about the important part of igniting that same spark for the generations to come. And that's where we'll continue to pull the string of prevention. So there are things you can do now for yourself. There's things you can do for the people that you're serving, whether they're currently living with Alzheimer's and dementia. Lifestyle still matters, right? And it's still going to impact their life. And the lifestyle matters for the care partners, and then it matters for that generation that's coming behind us. So that's the full picture of our conversation. I'll stop talking and let Annie introduce us, or Dr. Finn introduce us to starting kind of with the Lancet Commission and what is modifiable, right? What should we be focusing on? And we'll start there. So do you want me to share
Okay.
your slides?
Yes, please.
Okay, let me start that and hopefully I get it right. Here we go.
Okay. So since we only have a few minutes together today, I'm going to take a really high level view and sort of just skip to the punchline of all the data and the research. A lot of these slides I share with I'm doing a college course currently at the University of Cincinnati in brain health nutrition. I mean, think how far we've come. There's an entire semester long course, undergraduate in brain health nutrition now. And I taught one at Harvard earlier this year in women's brain health. So this is one way, I'm trying to get this word out. But the most important thing to start with is to know about the Lancet Commission 2024 was the latest update. I'm sure many of you are already familiar with this, but the Lancet Commission defines what are the risk factors that we know that are science-based by very rigorous data that are known to prevent dementia. And of course, Alzheimer's being the most common type of dementia, this is, very, very, important for Alzheimer's prevention. And the one thing to know about the Lancet Commission, this is a group of experts in the field from all over the world who convene once or twice a year, and they look at the most conservative data. The most conservative data meaning only the highest level, like randomized controlled trials. So you'll notice there's no sleep quality on the Lancet Commission. That's still being evolving. There's tons of data that sleep is important. Sleep is like a pillar of brain health, right? But they don't have the type of studies that they recognize, so it didn't basically make the list, if that makes sense. So you might have to get out your reading glasses to look at this because I always do. So first, what they do is they divide the 14 risk factors into life stage: early, middle, and late life. And there's a gap here, as you can see, but we're going to talk about that on the next slide. So one of the surprising factors for a lot of people is poor childhood education or lack of access to early childhood education. And these numbers mean if we were in a perfect world that everyone had adequate early childhood education, it would wipe out 5% of the global dementia burden. Okay, that's what these numbers mean. It's like how much could you reduce if this factor was eliminated? Now, many of us know that Alzheimer's affects women more than men. So as I'm ticking through these risk factors, it may occur to you that there's women-specific issues. For example, um, you know, girls are, globally less likely to be educated than boys, in the US and elsewhere. So 5% is huge, right? You don't see genetics on this list because genetics is not a modifiable risk factor, okay, nor is your, being born female or male. So these are just lifestyle factors. And then you get into midlife. This is the bulk of the research that we have seen in Alzheimer's prevention is what you do at midlife changes whether or not you develop dementia, years down the line. Okay. And this is changing. Researchers are throwing a wider net into young adults. Okay. As we'll see in a second. But this is the bulk of what we know is going on. And I'm just going to go through them. Hearing loss, 7%. That was just added recently to the Lancet Commission. Um, High LDL cholesterol. This was just added last year. So the higher your LDL cholesterol, formerly called the bad cholesterol, the greater the risk of Alzheimer's. Okay, so this is a super important modifiable risk factor because we have medications, we have dietary interventions, we have all sorts of ways to get people's cholesterol down. And it can be, it's like an easy lift. It's a low-hanging fruit really. Not that it's easy, but it's a low-hanging fruit because it's doable and we have all the tools. Depression, 3%, traumatic brain injury, 3%, physical inactivity, 2%, diabetes, 2%, hypertension, 2%, obesity, 1%, excessive alcohol, 1%. Okay. So these are the bulk of the factors that have been identified for midlife. For example, if you just look at hypertension, high blood pressure at midlife has an impact on developing a combination of Alzheimer's and vascular dementia later in life. So this speaks to keeping the tiny blood vessels in the brain really healthy, the small blood vessels, and hypertension at midlife is the beginning of small blood vessel disease. Okay. And it's really important for leveling the risk in socioeconomic groups and different ethnic groups, like Black Americans and Latinos, seem to have, a greater increased risk of Alzheimer's. They also tend to have more hypertension that goes untreated. So that's one of those, public health aspects that if everyone could get the treatment they needed for hypertension, which is actually not that difficult either, we have all of the tools. Access is usually the biggest barrier. Then we can reduce a lot of cases. And then in late life, we're looking at social isolation, 5%, air pollution, 3%, that was added a few years ago, and then visual loss, 2%. So when it comes to the visual loss and the hearing loss, 7%, this pertains to, say, hearing loss that goes uncorrected or visual loss that goes uncorrected. So needing glasses doesn't mean that, your risk of Alzheimer's goes up. But if you go through, 20 or 30 years without corrected vision, then it does go up. Same thing with hearing. And if people are still, figuring out exactly why that is. It's multifactorial, it's complicated. It has to do with, loneliness, isolation later in life. Social isolation accounts for 5% of global cases of dementia in late life. So a lot of this is like losing that sensory input, not being able to participate in groups, losing person-to-person communication. But also, it's affecting the brain in a certain way when those neural inputs seem to become less or go away. So this is the landscape. And the punchline being 45% of all dementias are potentially modifiable. Okay. Now this is a very conservative estimate by a very conservative group of Alzheimer's and dementia specialists. Okay. They're only going by the best studies. Like where is the nutrition in here? Right? Where is the sleep? These are really important pillars that every brain health expert agrees on, but our studies are not quite there yet to have enough randomized controlled trials to prove it. When you think about food, I mean, it plays into all of this, right? There's dietary approaches to lowering cholesterol and high blood pressure, certainly obesity. I include alcohol in here because I like to talk about brain nourishing drinks rather than brain harming drinks, physical inactivity, all of these things, there's a way in with nutrition, lifestyle, um, exercise, simple things like that. And most brain health experts, just so you know, think that this number is really closer to 80%. And so maybe we'll see, in coming years, if the research continues to build, that this number will keep inching up and up. Yeah. Okay, next slide. Now remember that little gap? Like what about the young adults? So this paper came out in Lancet Longevity last year. I was really happy to see it because I've been expanding my mission in the last few years to reach younger brains. That's why I've opted to, help out with college courses and things like that, and gearing some of my social media towards young adults, getting them interested in the food as a hook. So Lancet also decided that young adulthood was an unresearched area and an untapped segment of the population. Because, of course, all of these things that we talked about can start in young adulthood. All the habits that lead to the midlife factors start in young adulthood. And so, this 18 to 39 year age group is a new focus for Alzheimer's prevention. And it's really hard to get, I don't want to say kids. I have kids who are in their 20s. So I think of them as the kids, but it's also always hard to get young adults thinking about long-term brain health because they're not thinking about Alzheimer's, they're not thinking about dementia, they're not really touched by it by those of us who are midlife and older, but they do care about having, sharp focus, doing well in school, doing well at work, their executive function, their processing speed. And we have data, a lot of data on nutrition and how it helps with all of these things. So those are the things that I kind of hit hard. But there's a whole list. If you go ahead and show the next slide, that have been identified are factors that can be targeted at in young adults. Hearing loss. In my college course, I'm asking the students to come up with 5 things for each of these that they could do differently to reduce their risk of dementia later in life. It's as easy as like wearing earplugs when you go to a concert, paying attention to the volume on your AirPods, things like that. And they're coming up with really great ones. Like, how do you prevent these things? Brain injury, vision loss, hypertension, binge drinking. We're talking a lot about binge drinking, smoking, air pollution, obesity, physical inactivity, diabetes, LDL. There's a type of hypercholesterolemia called familial hypercholesterolemia that starts in adolescence and young adulthood. So that's why everyone should get a lipid panel as a teenager or young adult at least once because you don't want to miss those people that have high cholesterol early in life. So that's why that is in there. Social isolation, very common in this generation now. Depression, education, drug use, nutrition, stress, spirituality, microplastics, right? We're all concerned about microplastics, sleep. So these are all touch points for education. And like I said, the challenge often is not to talk about it in terms of Alzheimer's dementia prevention because young adults may not be thinking of that, but thinking about their quality of life and their quality of brain health and their brain health trajectory over the next 10 years. All right, next slide. So back to the Lancet Commission, we're going to dive into a little bit about what I've learned about nutrition and food, and then think again, like what are all the touch points here where diet can have a factor? Next slide. So this is the food pyramid that I created for my book, and it's based on a lot of research. It's based on like basically all of the legitimate research on nutrition and Alzheimer's prevention. And you probably have heard of the MIND diet. I know you've heard of the Mediterranean diet. There are certain food groups that have been identified as being neuroprotective. Okay. And that's what this is based on. And I changed it a little bit for, more recent data because some of these studies came out, 5, 10 years ago. But this is the overall food pyramid. We're going to dive a little bit into that. Next slide. So in my college courses, I'd like to we talk for 3 or 4 modules about all of these different dietary patterns. and the data behind them. So you're getting like the recap slide since we don't have a ton of time. Um, but basically, there's one thing that's important to know is there's not one brain protective dietary pattern. There's actually a handful of them that have been shown to either slow progression of Alzheimer's or vascular dementia or Parkinson's now. We know there's a big dietary link. We're hoping to find links for the other neurodegenerative diseases, but there are a lot of dietary patterns that are actually proven beneficial, at least based on very well done observational cohort studies, some randomized controlled trials. So that's really good news. This is solid science, and it's just getting better and better every single year. I mean, there's so many papers coming out every month that I have a hard time keeping up sometimes. So, Mediterranean diet is like the mother of all the brain healthy diets, okay? Because when we learned back in the 80s that the Mediterranean diet reduced the risk of heart attack and stroke in people that were at risk for that, that was the PREDIMED long ago. People started looking at it through the lens of brain health because we know what's good for the heart is good for the brain. So the Mediterranean diet became sort of like the template for a brain healthy diet. And here are the foods that are recommended. Here are the foods to limit or avoid. It's not very detailed in these things, but you've all seen the Mediterranean diet pyramid. I think you get the picture. Now, since then, there have been some spin-offs of the diet. Green Med is one that I love. It's a Mediterranean diet, but they boosted it with polyphenol-rich foods, specifically green tea, walnuts, and smoothies made with a special leafy green. And they added a bit of exercise component by giving everyone a free gym pass. And they specified cut back on red meat, especially processed meats. Two things we know have a strong link to developing Alzheimer's or other types of dementia. So the Green Med diet is remarkable because it has MRI data. They scanned everyone's brains as well as like followed them with cognitive studies. But they showed that people that boosted these food groups and followed the program, they basically, their hippocampuses were healthier as they got older. And the hippocampus, as you may recall, is the memory center of the brain. It's the place where you store your short-term memories. It's where long-term memories got consolidated. It's the first area of the brain to become vulnerable to the impact of Alzheimer's proteins like amyloid and tau. So studying the hippocampus and looking at an MRI is very powerful information for us. And to show that like eating a handful of walnuts every day can make you'll have a bigger hippocampus as you age is a really good thing to know. Or that drinking several cups of green tea a day could have that effect. So we have this study. We have the MIND diet, which came out of Rush University. Now, Dr. Martha Claire Morris at Rush was the first person to say, we know what the Mediterranean diet shows. It's good for the heart. We think it might be good for the brain. There were some preliminary studies about dementia reduction. She's like, what if we make the Mediterranean diet more brain specific? So that's what she did. She picked 10 brain healthy food groups and 5 food groups to limit or avoid. And she tested a group of people in Chicago who did not have dementia, about 1,000 people over 4.5 years. And she found that those that adhered most closely to this MIND diet had 53% lower risk of developing Alzheimer's within 4.5 years. And the people that followed it half the time, because you know how difficult it is to change your dietary pattern, it really is. The people that only followed the diet about half the time, they had a 35% reduction in their Alzheimer's risk. So this was the first study that showed that doing nothing different than switching up what you eat, switching up the food groups and the quantity and the quality of the food could change, whether or not you get Alzheimer's by 50% just in 5 years. So that was remarkable. And then we also have studies on whole food plant-based, sometimes also thought of as vegan diets. It's a more restrictive diet. There's no fish and seafood in here. There's no poultry here. Animal products are pretty much off the table. Sometimes even extra virgin olive oil is considered a processed food, depending on the definition. But Dr. Dean Ornish came out with a study last year that was very, very well done. It was a vegan diet, but he did something that no one else had done with these whole food plant-based diets. He supplemented the things that are often gaps in nutrition in a vegan diet, like vitamin B12, which you would normally get from animal products, omega-3 fatty acids like DHA, like you would normally get from fish and seafood, and a handful of others. So the Ornish protocol performed well. It performed very well. And so I'm happy to add this to the list of our brain protective diets, but also has to be done like very specifically and very carefully. And there's a whole bunch of data out of Rush University also. They took their Mind Diet sort of template and said, well, what if you don't want to follow a diet? You don't want to pay attention to different food groups. What if we're just looking at the flavonoids in foods? So flavonoids are they're kind of like nutrients, but they don't qualify as nutrients yet. They're bioactive substances that have a beneficial action in the brain and in the body. They're a type of polyphenols. Okay, they're very anti-inflammatory when it comes to the brain. They block oxidative stress in the brain that can come from all sorts of things. So they basically looked at, what if we look at flavonoid-rich foods? And flavonoids make plant foods colorful. Okay. You only find them in plant foods. You don't find them in animal foods. So they're basically the pigments in the plants that make them colorful, which makes it a really good teaching tool. It's easy to shop for flavonoid foods. It's easy to think about it in your diet because it's all the colorful foods at the grocery store or the farmer's market. Okay. So they basically did the same template of a study. And you know what they found? They found almost the exact same results as the Mind Diet. If you boost your diet with flavonoid-rich foods, then your risk of being diagnosed with Alzheimer's after 5 years is about half. So it lined up very well. So flavonoids are like a super important component of the brain healthy diet, obviously. So when I was writing my book, 2021, 2022, I was looking at all of this data, and I wasn't married to any one study. I really wanted to present a dietary pattern that's accessible to everyone, whether they're animal-based, whether they're, vegan, pescatarian, anyone who wanted to like be more brain healthy. I just wanted to make it more accessible, and it's doable. You don't have to, you can access brain health nutrition as long as you're having a dietary pattern that looks something like this. It can't be a restrictive diet because what we know that one of the most important things about brain protective diets is diversity, okay? Because we know that having a healthy gut is important for a healthy brain. And that's why I changed up the food groups a little bit. The first thing that you'll notice is I took out the red wine. Okay. And I mean, I think it was included in the Mind Diet as a nod to the Mediterranean diet studies and the Mediterranean countries where it's always on the table. And alcohol is consumed a lot differently, honestly, than it is today and in, maybe in our society. But now we have solid data, thanks to a huge study that came out of the UK in 2021, that no level of alcohol will reduce your risk of dementia. Okay, so that had to come off the pyramid. That had to come off the pyramid. And they started to notice like around 4 drinks a week is when, they started to see impact on people's brain volume by MRI. So there's no red wine, but I replaced it with the things that have very, very solid data, coffee and tea, especially green tea. Okay. The other thing I did was I increased the amount of leafy greens. There's so much data behind leafy greens. If you do one thing in your personal diet that you're not doing already, just make sure you're eating like an ample salad every day. About 2 cups raw would be, a good size salad every day. There's so much data to show that it makes your brain younger as you get older. Whole grains I kept as is, berries, beans and legumes, nuts and seeds. I added seeds as a bonus brain healthy food group because no one had talked about it or studied it in any of these studies. But a lot of people are allergic to nuts, and it's such an important brain food group. You get the same healthy fats and nutrients and flavonoids from seeds. So pumpkin seeds, chia seeds, all those good things. Fish and seafood is a very important brain healthy food group. So there's a strong argument for someone who doesn't eat fish and seafood to supplement an omega-3 fatty acid, a good product that includes DHA and EPA, because we know that that is so crucial. So fish and seafood is here. I added fermented foods largely because, again, it was not addressed in any of these studies in any specific way. But a study came out of Stanford a few years ago. Some of you may remember this. It was all over the news. But they compared a fiber-rich diet and a diet that was boosted with fermented foods. And they looked at the numbers and diversity of the gut microbiota, like the trillions of microbes that live in the gut. And they found that fermented foods had a little bit of a leg up on even fiber-rich foods. But towards the end of the study, the fiber people were catching up. But all of this is to say that we have to address gut health if we want to have a healthy brain. And all of these foods are high in fiber. That's kind of part of their sneaky superpowers is that they're all high in fiber, which is very, very important. And then I didn't want to take meat entirely off the table because the latest studies we have now show that processed meat and processed dairy are associated with dementia and Alzheimer's, but high quality unprocessed products are not. Okay, so we have this distinction. In a lot of the older data, meat was all lumped into one category. A hot dog was the same as a piece of grass-fed steak. Okay, and now we have distinctions from that. And so we can safely say that depending on a person's personal conditions, like basically their LDL cholesterol, whether or not they have diabetes, whether or not they're trying to lose weight, things like that, um, eggs, dairy, and meat can be a part of a brain healthy diet within guidelines. But as you can see, it's a really small part. It's a really small part. Okay. I have sweets up here because this is an enjoyable way of eating. It's not a diet. It's sort of a way of life. It's brain health is a lifestyle, the way I look at it, and food is the most joyful part of that. And also extra virgin olive oil was an official brain healthy food group in the Mind Diet and the Mediterranean diet, and I certainly included that. And the data on extra virgin olive oil just gets greater and greater. There was a pilot study looking at people with mild cognitive impairment and they gave them high polyphenol extra virgin olive oil and found a dramatic improvement in their cognitive symptoms. So it's not being used as a medicine yet, right? But we're getting these data points, these signals that show that it really is an important part of eating this way. So that's the brain health pyramid. That's kind of, my thoughts behind it. What do you do if you don't eat fish and seafood? You pay attention to your omega-3 fatty acids, and you can even test that with a blood test. What do you do if you don't eat eggs, dairy, and meat? It's fine. You can take that whole rung out. You just make sure you get enough B12, maybe as a supplement or through other, vegetarian or vegan foods, and get your protein. Hit the plant-based proteins really hard. Okay, so this can be modified for anyone. The only way you can't modify this is like if you're a paleo, for example, and it cuts out like a lot of the whole grains, leafy greens, berries, some of the vegetables, it doesn't work. It doesn't work because there's a certain number of servings you need to get every week. If you're on a ketogenic diet, it doesn't work quite so well either. This is based on a diet that is mostly monounsaturated fats with very small proportion of saturated fat, under 5% saturated fat. And so a ketogenic diet that is largely saturated fat is not going to fit into this pattern, nor has it been proven to reduce the risk of Alzheimer's and dementia. But people are looking at that. So, we'll see what happens. Do I have one more slide? I do. Oh, I just wanted to mention, everyone talks about the Mediterranean diet, right? And I told you it's like the mother of all the brain protective diets. But it's really important to recognize that the Mediterranean diet has so much study behind it because it has like the backing of the walnut people, the red wine people in Spain, the olive oil industry. So we have all of these sponsors. And so the Mediterranean diet this is the Medi pyramid, became the most studied dietary pattern in the world. But take a look at some of these other ethnic heritage diets. Like, what if you didn't grow up in a Mediterranean country or you don't come from a family that eats this way? It's really important to communicate that the Asian pyramid, the Latin American, the African American heritage pyramid, if you look at these food groups, it's very similar. It doesn't have the data behind it, but it's very similar proportion of all of these nutrient-rich, flavonoid-rich plant foods, fish and seafood with animal products on top. And so it's really important to recognize this. And it's not about having everyone fit into, like not everyone has to eat like someone who lives in Italy or someone who has grandparents from Italy. It's not really about that. Although, we do love our Italian food in the United States, so it does make it fun and delicious. But if people come from different backgrounds, sometimes this way of eating is more sustainable if they can fit it into their own life experience, what their grandparents ate, what their parents ate. or if they've traveled back to where their ancestors came from, what is it like back in their country? So I think that's super important point too.
Thank you so much. I was
Yeah.
jotting down my own personal notes of things and what excites me most, and it may connect with other people. As again, we're trying to think about, right, how do you turn this conversation into action? I'm really hanging on to the statistic you shared, the data you shared of, if even if you follow it half the time, there's a 30% reduction that you're going to see. And I think hopefully that gives people some encouragement, like it gives to me, because I know in my lifestyle, I tend to jump into things, and then it kind of like you find your way. Oh, how did I get out of the pool? That wasn't my intention. You got to jump back in.
And
So
that's such an important point because there's no such thing as a perfect brain healthy diet. There's no such thing as perfection. We're still learning about, what the optimal way is to eat for long-term brain health. We're still learning. I learn things every day about it. So
yeah.
perfection is not the point, but progress is good. Progress over perfection.
Yes, that's right. That's right. We have some questions in the chat, but I'm gonna take a minute to kind of get those arranged and written down so we can ask them. But
Okay.
I'm gonna thank you, Dr. Fenn, for that. We are gonna share the slides. Dr. Fenn also has a great handout to help you break this down. So there'll definitely be resources, as we always do after our webinars, that we'll send out to everybody. So don't fret if you didn't write all the things down. But Alex, jump in here and share with us, how you've been able to take kind of everything that Dr. Finn is talking about, the relationship that Hilarity for Charity has built with Dr. Finn and the Brain Health Kitchen, and how are you taking this to high school students and to college students to really help with that education. I think some pieces in with the work that you're doing too will help, because in our industry, we're hiring those people, right? So like,
Yeah.
how do we all come together to work towards the same effort? So Alex,
Yeah, sure. Yeah, very excited to talk a little bit about what we're doing at HFC and what we have been doing. And so for us, we have always operated off of the modifiable risk factors in terms of how we talk about brain health. And the way that we frame it is we talk about our 5 brain healthy habits. And we take those brain healthy habits, and that's how we build our curriculum. So we talk about sleep, and we talk about food and nutrition, physical activity, cognitive fitness, and emotional well-being. And those are sort of the buckets. That's how we bucket most of the modifiable risk factors. But from that Lancet report, you can see that there's a lot of them. But we needed to really make it accessible, especially when you're talking about young people. And our sort of learning curve initially was, right, how do you make kind of Alzheimer's prevention something that young people care about? Now, surprisingly, there are a lot of young people who are very interested in neuroscience, and sometimes that will sort of also be a conversation around mental health, and so you can kind of easily make that bridge. But in general, for like wide audiences for that, younger age group, it's a little bit of a harder sell. One of the ways that we aimed to do our brain health education was to sort of lean into the HFC ethos of entertainment and celebrity and laughter and to make it fun and accessible. And we've done that. And I'll talk a little bit about our platform, HFC Universe, which came first. And then a couple years ago, we set out to create what I think is still the only brain health peer education training program for Alzheimer's prevention, targeting high school and college students. So we teamed up with the College for the Professional Education of Teachers, which used to be Teachers College in New York City. And we worked alongside them to build this curriculum around the science-based information, how we framed our brain health habits, and create this curriculum that would make it easy and accessible for young people. And we have since trained over 200 young people to be now what we call brain health leaders. Because what we did learn over time, to your point earlier, Dr. Fenn, is that it's really about helping them understand, one, brain health is good for your overall health. And so practicing any number of these, creating those habits over time is going to help you feel good in the here and now. Two, these brain health habits will help you um, perform in the areas that you care about, whether you're an athlete or a mathlete or or a performer, a serious, academic, that any number of these habits, even if you really just focus on the one, will help you in the here and now. So we had to sort of pivot our messaging a little bit, and we have found that that has worked really well. We also wanted to make sure that what we were doing was working, because really, when you're talking about prevention, it's really hard to know, right? What effect it's going to have a year from now, 3, 10 years. Our ultimate goal is to really change the trajectory of the disease with brain health education, prevention education, in the same way we've done that with other public health considerations, right? Um, but we teamed up with a third-party evaluator who works with us to measure the impact on all of our programs because we wanted to know pretty early on, like, what are the early indicators here? Like, are they taking this in? Does it matter? And I just want to show you a few things from our last impact report that we're really excited to see. So this impact report can be found on our website. I'll drop that link in. But I just want to draw your attention. Well, one, you can see at the bottom, these are some of our celebrity faculty, some of our celebrity teachers on our platform, HFC Universe. So we teamed up with these folks to create very engaging and short videos that we call courses. And when students sign up for our video coursework, they watch these videos, they take, little quizzes, Quizlets embedded in our platform, and they receive a digital certificate for completing our coursework. We have Brain Health 101, 201, and 301. So each one of those courses does a little bit of a deeper dive. These celebrity professors each take on one of our brain health habits and does a little bit of a deeper dive. When we started looking at our brain health training, we were really measuring, like, what is the likelihood that they're going to use some of the strategies that they've learned. And you can see right here that sleep and nutrition really did very well in terms of students adopting or reporting that they've adopted those brain health strategies. But really, across the board, this is a pretty good uptick in terms of young people adopting brain health strategies to protect their cognitive health. And then here in this chart, this measures the intent of students, both who've taken our video coursework, that's HFCU, HFC Universe, and those who participated in our brain health training. And really, this first stat is what excites us so much, that 90% of the HFCU students and 84% of the brain health education students reported that they were motivated to take action that will improve my brain health. And that's a really high number.
Yeah.
So we were really excited to see that. Um, and, I think it just goes to show that young people do care about brain health. And I do think a lot of it has to do with the normalization of the conversation we've been having over the last several years around mental health and emotional well-being. And we want to normalize that conversation around brain health as well. We also like to point out that over 60% of students report that they were motivated to consider early screening. And that's also huge when we're talking about changing the trajectory of the disease, because many of the disease modifying pharmaceutical solutions that are coming to market are really targeting early stage. And so if we can in really empower young people to embrace brain health and learn how to advocate for themselves as they're, aging and going to their primary care physician, they'll start demanding these early screenings. And our hope is that that becomes, part of everybody's annual checkup from the neck up is what we like to share. So One, it seems like what we're doing is working. Two, we're seeing even 30 days later, I mean, even after they've, we do a follow-up survey 30 days later, even after the training, they're still reporting that they're practicing these brain health habits. And so that's really exciting for us to see. So we're combining our brain health education along with our sort of advocacy and activations through a national chapter program that we call the Youth Movement Against Alzheimer's. We have high school and college chapters in 32 locations, including South Korea, Canada, Puerto Rico. And these are young people who have all sort of taken a step up and said, we want to reduce the stigma, we want to raise awareness, and we care about brain health. So we're excited to continue to grow this work. And I think we're also starting to get really incredible feedback from students around what's important for them personally. And I think our next step is to really look at how can we then support schools and campuses to be brain healthy institutions. It's a big nugget. It's a bit of a moonshot, but it's also imperative. School lunches, campus dining halls have a lot of have a lot of work to do in terms of a brain healthy diet. But I think as students become more aware and they're the ones pushing for it, schools will have no choice but to start really paying attention and making some changes.
Fantastic. Thanks for sharing that. Yeah, I think, the science is there. Some of it's new and beginning to be connected and coming out. Some of it's old, right? As Dr. Fenn shared. But we're starting to make those connections to how it matters most for us. And I think the biggest part of that, right, is action, right? The science can sit there and somebody can do a report, but if we individually don't take action and make a movement or join a movement, then it just sits there. Same for like the school lunches and all of that. We know it. The people that are paying the bills for the disgusting food that's coming into our cafeterias and things like that, we all know it, right? But it takes somebody to take action. So that's what I'll ask people right now as we come into our last few minutes. Type in the chat maybe one action that you're going to take, whether that be you personally in your own life. And it can be as small as my action of I'm jumping back into the pool. I'm gonna jump back into the pool and I'm gonna try to tread water for a lot longer than I did before. Just in terms of, opening the book that Van gave me and trying another recipe, or buying healthier snacks for my children or whatever that might be. So put that for yourself in the chat. And then we did have questions, Dr. Finn. I want to make sure that we're getting those answered. We've had quite a few questions, several around dairy. People want to know why are you taking away my dairy? And if I can't give it up, are there cheeses that are better than other cheeses, or like how to help people around the letting go of dairy?
Yeah, it's such a good question. And in my newsletter, I do deep dives that have turned into what I call mini series because some topics you can't cover in one readable post. So we just did a mini series on dairy and dairy alternatives, which was like 6 or 7 like shorter posts long. And I was so excited to write about this because brain healthy eating has always been associated with cutting back on dairy products. And it's true. So this comes from the Mind Diet, which the original one came out in 2015, they got those stellar results in part because they drove the saturated fat content of the entire diet down by saying, cut back on butter, less than a tablespoon a day, use olive oil instead, and cut back on cheese. Don't eat more than 1 or 2 ounces a week. And all of us cheese lovers know that 1 ounce is a 1 inch cube,
Mhm.
right? And so I've always been associated with being anti-dairy when I'm actually not. I eat dairy more like a Mediterranean person, where I eat high quality, lower in fat, high flavorful cheeses like feta, Parmesan, Pecorino, things like that. But I don't snack on cheese,
Mhm.
and I eat it a little bit differently than, maybe typically in America. So fast forward 10 years, we're starting to see different data, just like with the meat issue. not all meat is off the table. Meat has brain health nutrients in it, and it's a great source of protein. Just to be very strategic about how you choose your meat. You definitely don't want it to be processed. That seems to be the worst part. Same thing with dairy products. So some dairy products are better than others. Okay. The way I can break it down most easily is the ones that are super high in saturated fat, you still want to limit in a brain healthy diet. This includes heavy cream. This includes a lot of coffee creamers, which are basically ultra processed foods. Ultra processed dairy is off the table, but you may not recognize your creamers being ultra processed unless you got your reading glasses out and looked at the label. And then you'd be like, wow, there's like 10 things in this. Okay,
Mhm.
so heavy cream, creamers, and butter. We want you to use more olive oil than butter. Okay. You can still have butter. Less than a tablespoon a day doesn't mean you can never have butter, but it's like really a reduction. Okay. And the dairy products that are actually brain beneficial or brain neutral are fermented dairy, like yogurt, which, as we know, can be a processed food, and it more often than not in the US it is. So, like unsweetened, unflavored yogurt that's high quality, right? And also hard cheeses that are high in calcium tend not to raise blood cholesterol. This is entirely new data that came out of the nutrition literature that I was very excited to see. So that I can give some cheese back to people and say it's okay, you can eat this cheese. And this is why in like places where they are known for longevity, like Sardinia, Italy, where they have blue zones, people eat these high quality hard cheeses 3 times a day. And they live to be 100 famously, right, without dementia. So there's a reason for that. It's the quality of the cheese. It's the fact that it's high in calcium, which changes whether or not the LDL is impacted. So yes, you can have dairy products, but you have to be really smart about it. And most of the dairy at the grocery store is not going to be what I would recommend for a brain healthy diet.
Mhm. Yeah, thank you. Well, we're a minute over. I know we knew that there would be a lot of questions, and there are. The good thing is that we'll send this recording, we'll send some great resources from both Dr. Fenn and Alex out. And I know we're all here, right? So you can respond to those emails that AGE-u-cate sends out, and we can get you connected to the right resource or the right person for questions we weren't able to answer today. I'll share this one last plug. AGE-u-cate is taking a small action for World Alzheimer's Month. 15% off for all of our programs or products on our website. So we hope you can take advantage. That's from a 1 hour online learning courses to more of our train the trainer programs. And I'll say use those savings and go buy Dr. Finn's book, or use those savings and donate it to Hilarity for charity so they can continue the great work that they're doing out there. We've got some people in the comments that are already connecting in with some of the program graduates on their brain health work with Hilarity for charity, which is great. And we've got some people out there that are buying more walnuts for snacking. Like I love all of these. Go do it. Just take an action, and your action too is staying connected. So definitely look out for that webinar, or the email we'll send with the webinar recording and our other resources, and stay connected. But Dr. Finn, Alex, thank you so much for being guests today.
Thank
We
you.
know it could be 2, 3, 4 hours of conversation. So hopefully we can bring this conversation back next year, or again, get you connected to where you can continue to educate yourself. But all
Thank
right.
you so
Yeah, thanks
much.
for
It's been a
having
pleasure.
us. Yeah,
Thanks,
it was a lot of fun.
everybody.
Take
Wonderful.
care.
Hi,
Here's to brain
everybody. Thanks
health.
for coming.
Bye.
Bye bye.